some good old faithful wooden hairbrush.
So this is soothing to people
Right.
that literally will listen to this to relax them, whereas you and I have a very different response. Like, this is really irritating to me. Like, to the point where if I heard this in the background right now, I could not focus on what we were talking. I would go to this and it would start making me like really irritated. It wouldn't put me in a rage, but it would. So I think there's a spectrum there. Welcome, everyone, to the GNI Podcast. Thanks for joining. As you know, we have a series of podcasts that encompass everything from ruptured aneurysms in the brain to today we're going to be talking about ASMR. And for those of you that don't know what ASMR is, which I did not know probably about a month ago, is autonomous sensory meridian response. And basically what that is think of the last time you heard a noise. So think of being in a quiet library and you hear some rattling. You hear somebody take a bite out of an apple. You hear some clicking. Their nails are clicking a pen. Two different reactions usually come out. Complete irritation and agitation. And the opposite is ASMR, which actually you get a very pleasant response. Traditionally, it's been described as a tingling in the scalp, going down the back of the neck, and it's a real physiologic response. There's very, very little known about it. And Kate, we've been talking about this. It's little to none scientifically or data-wise, but we know it's real. And for all the listeners out there, think about that. Like crinkling noise, is that soothing to you or is that really irritating to you? So anyway, so that's what we're going to talk about. And I want to introduce our, she's not a guest, part of Global Neuroscience Institute, Dr. Kathryn Lester, who's the head of our neuropsychology department and is a neuropsychologist. And I will add an excellent one.
Thank you.
And so we're going to just basically try to make some sense of this with the caveat, right, that we're both being very honest, that this is not something that we, I don't think anyone knows a real lot about.
Nope.
But there's about 4 million social media podcasts, websites, seminars. So it's a very, very popular thing. And that's why we're doing the podcast, because it was the amount of response and questions that we've got from this were astounding to me, especially for something I've never heard of.
Right.
Right. So my thoughts on it, and I really want to get your perspective as a neuropsychologist of, do you think that there's personality traits for this? Are there certain personality traits that, kind of on the spectrum, so to speak, where like OCD maybe?
I mean, there does seem to be this continuum, right? From an ASMR response to, on the other extreme, this misophonia, this negative reaction to similar kinds of sounds.
Can you describe that for just what misophonia is? Because that's really interesting.
So misophonia is like an intensely negative response to certain sound types. They're typically sort of orofacial sounds that you make while you're eating. Like
this?
Yeah, like slurping, right? Slurping noodles in a Japanese ramen restaurant. Or sniffing or coughing, kind of sounds you make with your mouth and nose and face. And they're annoying sounds. Most people find them kind of relatively annoying, but most people can tune them out. And people with misophonia have like this intense negative rage, kind of anxious, distressed response.
Literally where they get like angry.
Yeah. And they can lash out. There's oftentimes a behavioral component to it. So there does seem, and I don't know if we know enough to say this is a true continuum from really positive feelings to really negative feelings. They're often talked about sort of together in the same sphere, but the research is so new that who knows.
I personally, and again, no data, no scientific, but just I have misophonia.
Yeah.
My daughter has misophonia, and it was really interesting because the first time that I knew that there was I didn't really have know the name to it. And there's been a lot of publicity about it now. There's a couple famous people. One of them was, for those of you that are old enough to remember, Little House on the Prairie, Melissa Gilbert, to the point where it affected her life. Like she would like get angry and lash out at her kids and family. To your point, would literally get these inner rages and then feel horrible about it, like guilt, like, oh my God, I just yelled at my child because they were slurping their soup and it irritated me that much. And that to me, and what I would say is Alec, if you can put up the video, and I just want our listeners to see and hear this, and then I want to use this as a starting point to talk about what we were just talking about. Can you just pause that? So like right now I'm like really irritated.
Right? Me too.
So there you go. So this person, and nothing against her, she has a lot of subscribers.
Yeah.
They go to sleep with this. This calms them. And I don't know if you can maybe fast forward it just while we're talking to like where she's, some good
old faithful wooden hairbrush.
So this is soothing to people.
Right.
That literally will listen to this to relax them, whereas you and I have a very different response. Like, this is really irritating to me. Like, to the point where if I heard this in the background right now, I could not focus on what we were talking. I would go to this and it would start making me like really irritated. It wouldn't put me in a rage, but it would. So I think there's a spectrum there of how, and you mentioned something about tuning out. So I think probably the majority of people, and the little few studies, and they're all case studies of that, there's a subset of people that can just tune it out. We're like, oh yeah, I hear it, but it doesn't, I'm focused on what I'm doing, it's background.
Right.
Or people that it irritates, like me, or people that it's that spectrum where there's a release, and we'll talk a little bit about the imaging studies of neurochemicals in the brain that actually it's relaxing and calming to them.
Right. So there's, like you asked, I guess, initially about personality traits.
Yes.
Right. So there seems to be on the one end of the negative response spectrum, it's heightened anxiety, maybe a little OCD, and more sort of, I think the research, what is available kind of points to more sort of open-minded, like flow-like state when you're in this ASMR experience. Right. So, I don't experience ASMR. Do you?
No, the opposite.
Right.
I mean, this literally is like, I literally have to, because I went, when I was first asked to discuss this, and again, in complete, I didn't know what it was. And I started to kind of really look deeper into it. And I started going and seeing these videos, and I had to stop them. I mean, it really got to the point that they were so irritating. So here's this very pleasant woman, and I'm sure if she was talking normal, I would just, but I'm like irritated with her.
Right. Right. And we don't know if you can, maybe somebody with misophonia can also experience ASMR. I don't know.
See, I think
that.
they're opposite end of the spectrum. It's like, how could you, the triggers, and that's what they call, the trigger, which is, and again, for the audience, what we're talking about, the triggers are a whisper, like you heard, crinkling noise, they'll think of a bag of chips, like gently clinking, tapping of a finger, but it's also sensory where they'll have, and I think in this video, you can see her doing it, brushing one's, or even seeing somebody get their hair done or brush their hair. And we do know that there are sensory nerve endings in the scalp. That's why, sometimes people go and they get scalp massages and things like that. It releases the same type of chemical.
Right. And I think that there's a wide range of what might trigger a response for people. So sometimes it's not just the sounds, but it can be just like experiencing or watching a simulation of a close social interaction.
Right. So and again, if we look at this, you can see her, she's look what she's doing with her hand in the brush.
And also like those slow, repetitive movements.
Right. See,
so that to me is different than like hearing someone chew.
I was just going to say that, like, this to me isn't as irritating, even as that whisper. I mean, it's not it doesn't give me any type of ASMR response, but it doesn't irritate me as much as that whisper. Now, if you hear like the crinkling and those things, so I think it's about the trigger and what it's releasing in the brain. So, getting back to personality traits, within ASMR, the people that do respond, it's interesting because I started asking a lot of people, and now I'm like really curious about it because, you see different people's personalities. Right. I think you and I have very different personalities.
I would say that's right.
But we had the same response to that. Yeah. So whereas one of our partners, Ken Liebman, because he's a loud sipper. He's like my brother from another mother, and we've been together for 30 years. We've been through everything together from residency, and I get so irritated when we're like in a meeting or we're singing. It's like he'll do that. And recently we were having dinner a while ago with his wife too, and she's like, "Oh my God, I thought it was just me. It drives me." It's soothing to him. He said, when I hear that and other people doing it, he goes, "I've never really told anybody because it was kind of like, I thought it was like weird." He goes, "But no, it's very responsive." So I don't know if personalities.
Does he have a negative response to hearing other people do that?
No, not
there is
him.
Some like treatment modality that suggests mirroring that same kind of sound can help to kind of diminish the negative response to it.
That's interesting.
So I wonder if it's soothing in the sense that he's learned to kind of adapt to hearing it in other people by adapting it himself.
He said it's very relaxing to him. Like he basically has ASMR. Like the types of noises that irritate me are, and he used a word. He goes, it's very calming and relaxing, soothing. Those are the words that he used. So I think it's really interesting. And getting to the little bit of a science that we know, we do know that the neurochemicals that are released in people that feel this response fits into other types of heightened sense of arousal, of heightened stimulus. And it's, dopamine, oxytocin. Oxytocin to me was a really interesting one, right? Because there's the attachment component to it, right? So in mothers and babies, the oxytocin is at a peak level, and that's where that lots of studies have been done on this in animals and humans, that bonding,
right?
And that's something that's released in this. So I'm almost wondering that if there's something in childhood where these sounds and if it's something that either wasn't there or was there, that they're it's a very, very interesting.
Right. Well, that close social experience, the personal attention of she's like right in your face when she's delivering the ASMR.
Right.
Like, I think that is a component of it too, that intimacy level. And yeah, there's definitely some biological evolutionary roots in having those kinds of experiences.
Right.
And
So, so on that, spectrum, is it we got to ask this after, and one of the events that we did that we were discussing this, most of the questions were, is it dangerous? Is it a bad thing? Is this something I should be worried about if I have this response? And, and this is where I really like to pick your brain as a neuropsychologist. To me, I think I equate this to these apps like Calm, people listening to white noise before they go to sleep, ocean waves, whatever it is.
Right.
If it's something that's eliciting a positive response, it's helping you sleep, it's helping you calm down, it's helping with anxiety and stress, I think it's a great thing.
Right. I think it's almost like a treatment modality. Right. Right.
So as opposed to pharmacotherapy. Right.
So there's I think some indications that, for treating sleep, treating chronic pain, treating depression and anxiety. Stress.
Yeah.
I can't imagine what a negative kind of outcome might look like.
I think, and again, the majority of the people, interestingly, that are seeing this and using this on social media are young people.
Yeah.
Under the age of 20, and some kids.
Right.
So, the caveat.
That's how I was introduced to ASMR.
There you go, right? Because how old's your daughter?
My son is almost 12 and my daughter's 9.
But who introduced you to it, your son or your daughter?
I think, I don't remember.
And I guess they're close enough in age, but that's the point.
They are watching YouTube and
And that's the key. I think that's, make sure you know what your kids are watching. That's the only thing, because now for adults, great, have at it. But, kids, because if there is a sexual component to this, originally this was, there were some ties to that, and they changed the name. There's a person, her name's Jennifer Allen. She coined this term ASMR, which I'm sorry, Jennifer. thank you for bringing this, but that's a horrible name. And I think I read some things where she's like, she gets a lot of crap for it. And, it is very descriptive, but I think they wanted to flip it from being a sexual connotation to something that is more normal, natural, where people weren't embarrassed by it.
Right. I think, what I've heard of, and just, again, my very cursory kind of delve into the literature, is that 95% of people don't have any sexual response. It's not sexual in nature. It's sensual and about intimacy. But
it ties back to the things that are get the same hormones going, get the same neurotransmitters going, light touch, whisper. Like if you kind of lump those things together, and you're exactly right. That's why they got away from that. Yeah. And that's why I think it's a good thing that they kind of, because this is more appropriate of a term, because I think, but it's just a little too, we need a better name.
Right. Like social media will sexualize anything.
Well, of course. But the original, even prior to that, was this, and that's where, people who were studying this and looked at this came to that same conclusion that, no, this isn't, there's some of the things that kind of go to that, but and the responses are pretty typical for people to get them. They describe like scalp tingling, going down the back of the neck. There's just this kind of like almost euphoric.
My husband can remember distinctly his first ASMR experience.
Oh, is he?
Yes. And obviously he never put a name to it before.
How old was he?
He was in 5th grade.
See, that's interesting.
And a girl in his class was delivering a book report, and very nervous and very soft-spoken.
Right.
And very quiet in her delivery. And he just sat there like he was melting like into his chair, didn't know what was happening to him.
Yeah. Yeah. And that's it exactly. And that's really interesting to me. That's a child. 'Cause I do think there's a connection. And again, for the audience, there's no one that's an expert on ASMR. Right. It's real. And it's just, this is why we're doing this podcast, is to explore it. I personally think that it does get back to those original early childhood, and even in the, I don't want to say neonate, but early child bonding with the mother, that this is where this comes from, that it's just some deep-seated subconscious, eliciting that type of response. But very interesting. And the studies that we do have that we can kind of say there's something real is there's a study that was done, and I believe it was out of Dartmouth, where they took something called functional MRI, where you can be on an MRI table and it's open and you can get stimulated with things. They do it with animals and they do it with humans, where you can show a video of something very violent and you can see what areas of the brain that's stimulating, and everyone's different. That's why people react differently to that. And they did this with ASMR, where they did these noises, these things. And, if you and I were on functional MRIs watching this right now, we could see the pathways of things that are elicited. And there's a real reaction from the resting state, when there's nothing, it's just regular noise, and then this. So there's definitely something neurochemical going on with a real response.
Yeah. And looking at the fMRI literature in the misophonia population versus the ASMR experiencers, it looks like in misophonia, there's like this hyper connectivity between sensory input and experience and emotion. Whereas in the ASMR group, it's like a hypoconnectivity. There's less of a connection, or there's less myelin, that there's like a hypoactivation of these shared networks. And so that, the salience network is really, again, hyper-connected, I think, in those people with misophonia, which sounds evolutionary in the sense that the more attention you pay to auditory stimulation, the more likely you can escape some sort of risk.
Right.
So it may be developed from that evolutionary standpoint. But there's the salience network is like this attention space where you just can't tune out. You're hyper-focused to something. Whereas in ASMR, there seems to be a disconnect or a disinhibition, where you can get sort of into this flow-like state
and block everything out.
Right.
See, that's why I think it's on the same spectrum.
I agree.
I really do, and I think it's like any dysfunction, especially with the brain, right? Like think of Parkinson's, think of all these things are either overstimulation or understimulation,
Right.
and causing and so yeah, I think it really is fascinating. So I think the $1 million question is do you see at some point, and does this start getting you thinking as a neuropsychologist with your patient population of people that you would see fitting into that category of trying this and saying, okay, this is what the problem is, and let's try having you be able to disconnect from that. People that you see with anxiety, people that there's all these
Right.
other things, and at least having them try this. Do you think that there's a treatment modality in this from a medical standpoint?
Potentially. I think on the same kind of vein as like mindfulness or listening to music for relaxation, I think that ASMR shows a similar sort of physiological response, right? So there's, skin conduction studies that heart rate, all that kind of drops. Like there's a general calmness, right? So, I mean, of course, if you're anxious and you practice some sort of calming mechanism, that probably would lead to diminished anxiety. And in that sense, of course, that sounds like a promising sort of lead in terms of treatment.
Yeah.
But
because this to me is, and you're right. I mean, we know music, meditation, all these
Right.
types of things are forms of this, but this seems like a very specific type of triggers, sounds, all the things that
Right.
fit into ASMR, which are kind of that in a bottle, like very, much more focused and intense, where you can literally, because I think that's where this, I mean, if you look at the people that are going on to these podcasts and following these people, I mean, it's really, really, really going up. And, to me, from a treatment standpoint, from a helping a patient standpoint, I think there's some utility in, again, trying it and saying, look, here's try this, see if it makes a difference or not. It might be a good study that we can do within
Yeah.
GNI. There's zero downside to it, right? It's a
Right.
questionnaire of, I think we can, look at some of these things and say, here's the site, go on, and better than anyone, figure out when to do it. Like if you feel that you're going to be in a stressful situation,
Right.
if a stressful situation's coming on, almost like a form of meditation. I think it would be really interesting.
I think it would be too. Like going to bed at night, somebody who's
Yeah.
anxious and can't shut their
Sleep.
brain off, right?
Yeah, because
I have
again,
lots of patients that probably would fit into the criteria for a study like this.
yeah, I mean, my God, insomnia. Can you imagine
Right.
if there was something that actually worked for people
Yeah.
with insomnia? I mean, this could, but now the issue is who responds to it, right? Because if I got prescribed this, it would be like gas on fire. it would make, I mean, again, there's an irritating response.
Right. And I mean, the negative effect of it would be pretty short lasting, right? If we
Oh yeah, of
prescribe
course.
this to somebody.
Yeah, you turn it
and-
off. I mean,
right.
the second you stop, yeah, of course.
Right.
But I think, I guess the question too is, do you think this is on the same spectrum? It would be interesting to like, I can't meditate. I'd love to. I'm jealous of people that can do it. I have
Yeah.
ADD. I'm like, back in my day, we called it ADD. It's now ADHD and, the whole spectrum. I've learned to harness it
Right.
and to use it for, to kind of get stuff done and to, in a very healthy way. But I can't meditate, and I've tried it, and I'd love to be able to do it. I'd love to be able to do yoga, but I can't.
Yeah.
I mean, and so I wonder if the people that can meditate and that are able to kind of do that,
Right.
if this would be a huge adjunct to them.
Right.
And
Right,
people who
'cause
can't, don't.
I think that gets back to the not that you're not open-minded, but the personality kind of characteristic of people that kind of are ASMR experiencers and creative people, musicians that can kind of disconnect and get into this.
Yeah. See, I don't know if it's the open-mindedness, because I would definitely consider myself open-minded. And people that know me, if you ask them, I'm very open-minded. I'm music, all those things are completely in my wheelhouse. I mean, writing and like that is what calms me down. And that is but it's, I'm very confident it's a chemical. There's some type of, because why are people, kids and adults that have ADHD, why are they responding to the neurochemical alterations from the pharmacotherapy?
Right.
Because and again, this is just conjecture, but in my mind, if we can replace pharmacotherapy with something like this, and maybe this opens up a door for somebody that couldn't meditate before, and but again, I think, what do you think? Do you think we should do the study?
Yeah, we should do a study.
You heard it, guys. We're going to do, I think it's a great thing. We can do and we love feedback because, please, with your responses, we always get great feedback because we'd love to hear our audience's feedback on this, their thoughts on this, ideas on this.
Right.
And I think a real simple questionnaire of, for the right select patients, did this help you? Did it not help you?
Right.
Did it, where did it help you?
And what type of stimulation, maybe?
100%.
Yeah.
100%. And that's why I think maybe even we can do like a video edited where that's actually a great starting point. Which one of these is good? Which one of these you respond well to? Right. Then you can kind of hone it. Okay, it's whispering. So now you can do a bunch of different whispering. It's the crinkling. It's the physical, like watching somebody comb their hair and watching somebody do. There's another one.
Like folding towels.
Folding towels. That's right. That's an awesome one too. And for those of you that want to get your spouses or kids or whatever to fold laundry, just show them that video and say, here you go, have at it. Well, that's great. Well, I think, this was important enough that, again, in a million years, I never would have thought of this until I saw the response and how many people were truly, and your husband is a perfect example, who didn't put a name. I think most people have this, but they have never been able to put a name on it.
Right. Or think everybody shares the same experience and it's nothing
I'm telling you that
worth talking about.
Yeah.
Right?
I mean, the person I was talking about before, I mean, he wasn't ashamed, but he was just kind of like, I don't want to say anything to anybody because I thought it was weird. You know what I mean? Like, but it's how I feel. So I think that's a great thing just for education that people, again, somebody that knows they have that response, that they can use it, and especially if there's some guidance with that of how to use it to help them with, with a healthcare provider like yourself to harness it in the right way and not just, put it on when you get stressed, but use it almost as a drug.
Right. I started just now thinking about like all the new literature, not that we should do any studies on microdosing or anything like that, but the same kind of.
As far as?
Like psilocybin and.
Well, elaborate on that a little bit. No, just for the audience
Well, there's I think a new evolving treatment space using like psilocybin and hallucinogenic drugs on a very sort of microdose, small dosage to create some expansion of.
That's a good podcast because I'll tell you my opinion. I don't know what you think. I think that it is going to end up in a being able to be prescribed.
Yeah.
And I think we're getting close. And you correct me if I'm wrong, but I always read about these things where I think marriage therapists were using things for ecstasy. People in severe stress, they were prescribing, especially and then the psilocybin, and certainly we all know marijuana. And now, within GNI, we've done, we had a grant and a study to look at, because a lot of our patients, especially the chronic pain patients, the Chiari patients, were coming in and they were like, what helps? Pot's the only thing that helps me. And so we put science to it and great study that looked at what are the different strains, what is it, taking it sublingual, smoking it, what works best for each person. I think that's a great idea and in conjunction. So basically what Dr. Lester is saying is you drop some acid, and this has been going on since the 60s, right? You just drop some acid and you put on one of these ASMR things. You have somebody doing your hair. I love it. Soon to be at the GNI locations. It's a joke, guys. It's a joke. So, well, Kate, Dr. Lester, thank you so much for joining us.
Thanks
I think this was
me.
great, and we'll wait for your responses, and we will answer our audience's questions as they come in. And if there's something that there's a common theme, we'll do a next podcast on it.
Sounds good.
Thanks a lot. So if you enjoyed our podcast today, you can go on the GNI YouTube site and see the rest of our podcasts as well. And if you want more information about GNI or this topic, you can go to gnineuro.org. And we look forward to seeing you at the next GNI podcast.